Hello and welcome. This is Prevention Saves. I'm Melanie Eisen with the Sullivan County Anti-Drug Coalition. And today our focus on our conversation is going to be on prescription drug abuse. And I want to introduce Alice McCaffrey, the Director of Sullivan County Anti-Drug Coalition, and we'll be interviewing her today. So Alice would tell us a little bit about what the coalition is doing for preventing prescription drug abuse.
So we are one of 10 coalitions in Tennessee that got the Partnership for Success about prescription drug abuse, and we are doing prevention efforts such as Count It, Lock It, Drop It, which hopefully everyone has heard about because Blue Cross Blue Shield looked at that program and supported it. They thought it was a great program to have. The purpose of Count It, Lock It, Drop It is to decrease the free medication supply that are found in our household cabinets. We're also trying to decrease NAS through several efforts, including education, and then particularly getting the word out that if you are a woman of childbearing age taking an opioid, you should consider a long-acting reversible contraception, the can't mess up method.
Yeah.
We also have a lot of information for the medical community. We do health forums, but we have a website for them, and we try to talk about chronic pain guidelines, checking the controlled substance monitoring database. That helps make sure that people are not doctor shopping, which means trying to get medications through doctors. And then we've been doing a lot of promotion of the new office-based opioid guidelines to make sure that we are getting rid of folks that are just in it for the money. And we're always working on reducing the stigma of addiction.
That's a lot of different areas that we're covering in the coalition. Do you think that most of this work that's happening around prescription drug abuse, do you think it falls underneath prevention, harm reduction, or intervention?
Most of the work that we're doing is clearly prevention, but some of it does cross over into intervention. And in fact, we won't talk about this a lot today, but we are getting a new grant that is definitely harm reduction to get naloxone out in the community. But most of the work that we do is preventing the addiction in the first place. And when that hasn't happened, trying to intervene quickly before dependence becomes addiction.
How does Count It, Lock It, Drop It, how does that help with prevention of substance abuse?
So we know that 68% of first-time users get their medications for free. And when I say get them for free, I mean they get them out of people's medicine cabinet, either in their own home or they go into homes. 66% of people who had that first experience excuse me, and liked it still get their medications for free. And when you're looking at chronic users, whether they have a dependence or an addiction, 41% of them are getting their meds for free still. So by getting the medications that we're not using out of our homes, taking them to a drop box, which all of our law enforcement agencies have 24/7, that is reducing that supply. It's also sending a message out there that each and every one of us has a part to play in preventing this epidemic and being aware.
How about when we talk about the NAS? What is NAS?
NAS is neonatal abstinence syndrome. That means a baby is born into the world dependent on the drugs they were receiving while they were in the womb. And they go through withdrawal when those medications are pulled away. An NAS baby, neonatal abstinence syndrome, first of all, it's just a horrible way to start life. Economically, it is very costly. It's somewhere around $68,000 to care for these babies in NICUs, as compared to approximately $6,000 to $7,000 for a normal birth. We don't have a lot of information about the long-term effects of being born dependent on drugs. And so there's a lot we don't know, but we know it is a terrible problem in Sullivan County.
Yeah, that seems to be very important in prevention of that part of it.
Yeah, and the best prevention for NAS is, if you're on an opioid, to be also on a contraception. And if you get a long-acting reversible contraceptive, you don't have to worry about it, because unfortunately, sometimes being on an opioid means that you're not making the best decisions, or your thinking isn't optimum.
Right.
So just not having to worry about that is the prevention for NAS.
Since we are prevention saves, what do you think is saved by these initiatives, by Count Lock It Drop It and all the other initiatives that the coalition's working on?
If we can prevent addiction, we have saved a lot of brains, we have saved a lot of money in treatment, we have saved a lot of citizenship, we have saved communities, because when the members of a community are all productive and working at their peak, communities are very different. And we're hearing terrible stories across the entire nation anymore about communities that are devastated, deaths that happen daily because of people who are addicted. So preventing addiction is a critical piece to saving lots of things. And once you have an addiction, we talked about the free medications that are in our medicine cabinets, but once you can no longer get your drugs for free, then there's a lot of crime to get the money that you need to buy the drugs illegally on the streets. And then on the streets, there's a terrible problem with counterfeit drugs, and fentanyl especially is the one that we're hearing the most about. But heroin's coming in too. When you have an addiction, you can't get your medication. Many people turn to heroin because it's a lot cheaper than trying to buy a prescription drug if you don't have a prescription.
Yeah. Why do you think this is such a problem here in East Tennessee and Sullivan County?
I wish I knew. I really wish I knew. If we knew what was causing it, it might be easier to solve. But in the meantime, there is so much that we can do about just educating people and people helping each other. Because addiction, or rather sobriety, isn't lack of addiction. Sobriety means you have relationships. You are in good relationships. You have the support you need to do what it is that you need to do to be the healthiest and best you.
What else does our organization, does a coalition need from the community? What do we need to help address this problem?
We just really need a lot more people in the community that understand this problem and become part of the solution. We really need people to understand that addiction is a brain disease. An addicted person is not that troll living under a bridge. An addicted person often got there because of an accident, because of getting medication possibly that they didn't need. One of the things we're trying to teach doctors is that narcotics for pain initially is not the best solution, and it can lead to dependence. So trying to get people to understand how to take care of themselves when they are in pain, which is hard. When you're in pain, your brain's not working right either.
Right, you just want it to end.
But the National Safety Council says for acute pain, which is that immediate, you've twisted your ankle, ibuprofen and extra strength Tylenol work better than a narcotic, and there are lots of studies to show that. So getting that message out is really important, and then for the community to be counting their medications in their house, to be disposing of the medications, and to lock up medications that they need in the home but that are dangerous. And the coalition does have lock boxes that we can provide for homes that need it.
How would someone be able to get one of those boxes?
Just give us a call.
Okay.
And let us know. You can come to our website, which is scadc.org. That's for Sullivan County Anti-Drug Coalition, scadc.org. And look at the Count It, Lock It page and find out about contacting us.
Do you have any other tips for, besides locking it up for parents, for grandparents, for caregivers?
Talk to your kids about this. This is critical. No matter how much eye rolling you see, they are listening. There is over 40 years of studies that prove that when parents talk to their kids, the kids listen, the kids are protected when they are out and about. They have the information that they need to make better decisions. And sometimes they can just say, I'm sorry, but my parents will kill me.
Yeah.
Not really the words that we would choose, but it works. And we hear kids all the time use their parents as their excuse for making better decisions in their real life situations.
Yeah, when they have to make those decisions on their own. Yeah. If you had the power to change one thing to decrease the use of prescription drugs, what do you think would be?
Turn off the spigot.
Yeah.
We need to have fewer doctors writing these prescriptions. I recently had dental surgery. I told the dentist before I did not want the medications. I left a little bit loopy from the medications of the surgery. I get home, I have a prescription for exactly what I said I didn't want. I used ibuprofen and Tylenol was fine. So yes, turning off the spigot means that we don't have the medications out there that cause the dependence, that create the addiction.
And we can be our own advocates in that.
Absolutely,
Saying
absolutely.
this is not what we want. Right.
Yes.
That's very important, yeah. Is there anything else that the community needs to know about this and how they can participate in prevention?
I think one of the main things we really want people to understand is that addiction is a brain disease. It is caused by certain things that lead to that brain disease, but once the brain is diseased, once the brain is addicted, it is a disease. And it is not a moral failing, and we need treatment, we need support, we need a community that is all willing to work together to help people recover and then stay in recovery.
If people want some more information, how can they access that?
Probably the best way is just to go to our website. You can do that on your computer or your phone or your tablet. Again, that is www.scadc.org. There's ways to contact us by email or phone at the website.
Okay.
You can also like us on Facebook.
Yeah.
SCAD Coalition. We put out, especially for parents and caregivers, grandparents, information that help you talk to your kids and let them know what's happening.
Well, all that sounds very important, and another way I want to invite people to, become involved with the coalition. It's easy to look at our website, like our Facebook page, but also we have coalition meetings every other month. The first Thursday, second Thursday.
Second Thursday of odd months.
We have coalition meetings the second Thursday of every other month. That would be January, March, May, and then July is the next one, and so that is at the Sullivan County Regional Health Department in Blounteville. It's from 10 to 12 And we always have very interesting speakers and different topics at each of our coalition meetings. And then there's a period that we have our work groups around the tobacco, alcohol and underage drinking prevention, and then prescription drug abuse prevention. And that is a really interesting way to get involved in the prevention efforts, to have those conversations with other like-minded individuals, and to really do the work in the community that's important. So we do encourage everyone, parents, educators, business people, everyone to come out and participate that way. It's very, very interesting work. So please, if you do have questions or want to look up those times, just check out the website, and you should be able to find that information. Thank you so much for watching our program today, and we look forward to next time. Thank you.